Inflammation has become one of the most feared words in health. Every ache, every tired morning, and every uncomfortable meal is blamed on it. The internet tells you to eliminate inflammation completely, but that would be a mistake. Without inflammation, your body would struggle to protect and repair itself. Ask the simple question: why does an injured finger become red, warm, swollen, and painful? Is the body making an error, or is it doing something useful? The answer changes the entire story. Inflammation is not automatically damage. It is often a response to damage. Think of inflammation as a fire department. When tissue is injured or threatened, the body sends an emergency response. Blood flow changes. Chemical signals appear. Immune cells move toward the problem. The goal is not to create chaos. The goal is to contain the danger and begin repair. Inflammation can begin for different reasons. A cut, an infection, a burn, an irritant. Damaged cells send signals that something has gone wrong. The body does not wait for you to understand the problem. It begins responding immediately. Redness, heat, swelling, pain. These familiar signs are not random. They reflect changes happening inside the tissue. Blood vessels adjust. Fluid moves into the area. Chemical signals attract immune cells. The body is creating a temporary repair zone. Swelling feels uncomfortable, but it can serve a purpose. Fluid moves into the tissue as part of the response. The area becomes harder to ignore. Movement may become limited. The body is effectively saying, protect this location while repair work begins. Pain is unpleasant, but it is not meaningless. Pain tells you that something needs attention. It may encourage you to stop using an injured area aggressively. The goal is not to worship pain. The goal is to understand that the signal exists for a reason. Immune cells act like workers arriving at an emergency site. Some help respond to harmful microorganisms. Some help clear damaged material. Some release signals that coordinate the next steps. The process is complex, but the principle is simple. The body organizes a response. Short-term inflammation is called acute inflammation. It begins quickly. It is meant to solve a specific problem and then settle down. A cut heals. A bruise fades. The swelling reduces. The fire department arrives, performs the work, and eventually leaves. The ending matters as much as the beginning. A healthy response does not stay permanently activated. Signals change. Repair continues. The emergency crew withdraws. The body returns toward balance. Inflammation is useful partly because it is supposed to have an ending. Now imagine the fire department never leaves. The trucks block the roads. The sirens continue. The water damages the building. A system designed to protect begins creating additional problems. This is the basic idea behind chronic inflammation. Chronic inflammation does not always look dramatic. You may not see a swollen ankle or a red cut. The signal can remain active quietly. That is why the phrase becomes confusing online. Visible swelling after an injury and long-term inflammatory disease are not the same situation. Inflammation is not identical to infection. An infection involves harmful microorganisms, such as bacteria or viruses. Inflammation is the body's response to a problem. An infection can trigger inflammation, but inflammation can also occur without an infection. This distinction matters. If an infection is present, the correct treatment depends on the cause. If an autoimmune condition is involved, the strategy is different. If an injury is involved, the plan changes again. One vague word cannot replace a real diagnosis. Sometimes the immune system attacks healthy tissue by mistake. This can happen in autoimmune disorders. The fire department responds, but the target is wrong. These conditions require proper medical assessment and individualized treatment. They cannot be solved by a viral drink recipe. Inflammation can also continue when tissues face repeated irritation. Smoking is one example. The body keeps receiving a harmful signal. The issue is not one dramatic event. The issue is exposure repeated often enough that the response has less opportunity to settle. You may hear about a blood test called CRP or C-reactive protein. The liver produces more CRP in response to inflammation. The test can help show that inflammation is present, but it does not tell the entire story. A CRP result cannot identify the cause or the exact location of inflammation by itself. Infection, injury, autoimmune disease, and other conditions can affect the result. One number is a clue. It is not a complete explanation of your body. Fatigue does not automatically prove chronic inflammation. Bloating does not automatically prove chronic inflammation. One difficult week does not automatically prove chronic inflammation. Symptoms deserve careful evaluation when they persist. A social media checklist cannot replace clinical context. The wellness industry understands the power of this word. Anti-inflammatory tea, anti-inflammatory powder, anti-inflammatory morning routine, anti-inflammatory detox. The label sounds scientific, but the question remains the same. What condition is being treated? What is the evidence, and what is the dose? Turmeric is a useful cooking ingredient. Curcumin, one of its components, has attracted scientific attention. But a laboratory finding does not automatically prove that a supplement treats every inflammatory condition in real people. Food, supplements, and medicines are not interchangeable categories. The word natural sounds safe, but natural substances can still create side effects or interact with medications. A supplement aisle is not a risk-free zone. Before adding a product, ask whether it solves a clearly defined problem and whether the evidence supports the claim. Not every inflammatory response needs to be feared. Exercise creates a controlled challenge. New physical activity may lead to temporary soreness. The goal is not to eliminate every signal from the body. The goal is to distinguish normal adaptation from persistent or concerning symptoms. Exercise provides a challenge. Recovery allows the body to respond. Sleep, appropriate nutrition, hydration, and rest support the pattern. Training without recovery creates a different environment. The body needs both effort and repair. Your body does not experience one magical ingredient in isolation. It experiences your overall pattern. A balanced dietary routine is more useful than chasing one spice, berry, oil, or supplement as though it can erase every other habit. A practical eating pattern can include vegetables, fruit, legumes, whole grains, nuts, and appropriate protein sources. The goal is not perfection. The goal is to provide a repeatable structure that supports general health without turning food into a daily source of fear. Sleep is not an anti-inflammatory miracle cure, but sleep is part of the environment in which the body operates. When sleep repeatedly disappears, healthy decisions become harder. Energy falls, movement decreases, stress rises, patterns begin reinforcing one another. Movement is not only a calorie-burning task. Walking, strength training, and regular activities support overall health. A body that moves regularly receives a different daily signal from a body that remains seated for most of the day. Do not allow wellness trends to distract from major risks. A turmeric capsule cannot cancel repeated smoking exposure. A detox tea cannot erase a harmful pattern. The unglamorous habits often matter more than the exciting product. Stress can influence the body, but do not turn every difficult emotion into an inflammatory diagnosis. Stress is real. Recovery matters. Boundaries matter. Sleep matters. Professional support may matter, but fear-based self-diagnosis often creates more anxiety than clarity. Do not stop prescribed medication because a video told you inflammation is natural. Useful inflammation and harmful inflammation can both exist. Medical treatment may be necessary. The correct decision depends on condition, symptoms, risks, and professional guidance. Do not treat medication casually in the opposite direction either. Over-the-counter products still have risks. A familiar package is not permission to ignore dosing instructions or interactions. Speak with a qualified professional when you are uncertain. Try a realistic 7-day experiment. Walk regularly. Protect your sleep. Add one balanced meal each day. Reduce unnecessary ultra-processed snacks. Avoid smoking exposure. Do not buy a miracle supplement. Observe the pattern rather than chasing an instant reset. Look at the products on your shelf. Which ones address a clearly defined need? Which ones have credible evidence? Which ones were purchased because a video made you anxious? A responsible routine begins with asking better questions. Now examine the ordinary day. How consistently do you sleep? How often do you move? What does a normal meal look like? How much stress follows you into the evening? Your body experiences the daily pattern more often than the occasional wellness ritual. Seek medical attention for severe or rapidly worsening symptoms, persistent fever, significant swelling, breathing difficulty, chest pain, or symptoms that concern you. Do not delay appropriate care because an online video promised that food or supplement would solve the problem. A symptom that persists deserves attention. Repeated joint swelling, prolonged pain, unexplained fever, or other ongoing changes may require medical evaluation. The goal is not panic. The goal is precision. Can you explain inflammation in one sentence? Try this. Inflammation is your body's emergency response to damage or danger, and the problem begins when emergency response continues for too long or targets the wrong tissue. Do not declare war on your immune system. Support the resolution. Move regularly. Sleep consistently. Eat a balanced pattern. Avoid smoking. Use medication appropriately. Seek medical advice when symptoms persist. The goal is not zero inflammation. The goal is an appropriate response. Inflammation is not the enemy. It is your body trying to protect you. But every emergency response needs an ending. Respect the fire department. Reduce unnecessary alarms. Support recovery. And remember, health is not the absence of every signal. It is the ability to respond, repair, and return to balance.